Hello, everyone. Welcome back. Welcome back again for another episode of the MDI Prep INBDE podcast, where we share actual topics that have appeared on the exam. As always, remember that these brief podcasts are just to introduce you to what appears on the exam and not intended to replace any of the actual study programs. Now, remember, if you want an actual comprehensive study program, if you actually really want to pass the test on your first attempt, then you're going to want to join the next INBDE class. In order to join that class, just visit us at www.mdiprep.online, or you can give us a call at 1-888-827-9881. And just let me say this, passing this exam is so important because this could mean the difference in your life. It could literally mean the difference in your family's life. So we really encourage you to take this seriously. Whether you take our course or any other course, make sure you take some type of course to prepare you for this exam. Well, guess what? Today we have some good stuff going on. We have Dr. Marion, who's going to be talking to us today about pediatric dentistry and some of the questions that you might see on your INBDE exam related to pediatric dentistry. So get your pen, your paper, and get those ears ready because she's going to share some good information with you. All right, so let's welcome Dr. Marion to the program.
Thank you. Thank you.
It is so good to have you back. It seems like you're here every day, right?
Yeah, I know. It's nice actually to know that people are making use of the podcast and it makes me feel good and makes me feel like it's helpful. And
it is.
Yeah.
It is. I've gotten a lot of good feedback from people who are listening to the podcast who say that, I've even had some people say they remember the actual question on their exam.
Yeah.
So, part of what we do is to try to help other people, and giving back is one of those ways we can do that.
Yeah, exactly. Yeah.
So what are you going to be talking to us today about?
So I'm going to talk about pediatric dentistry and what kind of questions came up on my exam. So I divided pediatric dentistry, in my opinion, according to 3 categories, which is they usually ask about apexogenesis, apexification, and chronology. I will start with the chronology, and I will say this is very important. Everyone who's been to a dental school, they know the sequence of the primary teeth and the permanent teeth, and when is the root completed? So those are questions. It can get difficult and it can be straightforward. Okay. So usually it comes up like a case, patient box. They will ask a patient who's 10 years old, how many teeth you will see in his mouth. So you will start with, 10 years old, how many primary, how many permanent. So there are lots of ways how to remember or how to remind yourself with this. And I remember I took those ways in the course. Right.
So during the MDI Prep course, I guess they went over those things with you on easy ways to remember those things.
It was helpful. It's definitely helpful.
Okay, gotcha. So like at a 10-year-old, how would someone remember that? Like, what would be the?
Yeah, they have they write the sequence of the teeth, and they connect it together with and it comes up as a name. So I remember it was main. So that's the sequence of the lower first incisor, lower incisor is the first one, and then the second one is the upper incisor. So they connected all together, and they form a name, so it sticks to your mind.
Oh, I got you. So this is the chronological piece that you were talking about. So knowing the teeth age and everything like that.
This is important.
That's very important.
Yeah, very important. And you don't want to miss this point. I mean, if you know the age, if you know how many teeth, so it should be easy for you.
Okay. So the question itself regarding the chronology would be, can you repeat that question, how they ask that question from the patient box?
Yeah, it will be like a 10 years old patient came to your clinic and how many teeth you will find in his mouth.
Okay, total number of teeth.
Yeah, and they will trick you with like the permanent and the primary. Because you'll find it's a mixed dentition.
Okay, gotcha.
So you'll find both.
Okay, gotcha. Okay, perfect.
So you definitely need to differentiate between both.
Both, okay. And those are the kind of things that you can learn in the class.
Yeah, exactly. And ways to remember as well.
Okay, perfect. Okay, what else you got?
Another question that is very famous on the exam.
Okay.
And it came up on my exam and it came up on other people's exam.
Hold on. Get ready for this. Are y'all ready for this? All right.
So it says best storage medium for a vulgate tooth is.
Okay.
They give you 4 options. Usually it's the same exact 4 options.
Okay.
Hank's Balanced Salt Solution. We call it HBSS.
Okay.
The second one is saliva. The third one is milk. And the fourth one is water.
Gotcha.
So what is the best storage medium if you had a patient who had his tooth out, bulged out?
Yeah.
And which media would you use? And there is a lot of conversations going on this.
Yes. That happened to me in football. I played football.
Yeah.
And, we were just, playing football. We just learned you put in some milk and go to the dentist. Is that true?
Yeah, it is good. But I mean the best.
Yes.
Because they're asking for the best.
The best, right.
It's good. Like if you have milk, it's going to serve the purpose.
Right. But it's not the best answer.
Exactly. And that's how actually they ask their questions, because sometimes, it is a good answer, but it's not what they want.
So what do they want in this case?
Yeah, they want the HBSS, the Hank's Balanced Salt Solution.
So we just heard, what I think I heard was another pearl.
Yeah, absolutely.
All right. Can you share that pearl? So the pearl is?
The best storage media for a vulgate tooth is HBSS, which is Hank's Balanced Salt Solution.
Very good. I love that. Great. Okay, that's good. What else do you have?
So the other question I have is actually 2.
Okay.
One very straightforward is usually it comes up in exams. The complication of local anesthesia in kids.
Okay.
This is actually also, if you've been practicing, you usually see it a lot in the clinic.
Okay.
A kid will come to your clinic and you will work on him and do whatever needs to be done, and then we'll go home. The mom will send you a picture with his lip very swollen. And if you don't know the case, you'll freak out.
Oh, okay, gotcha.
So it's usually, if it's a kid and he's numbed, so he or she doesn't feel her lips,
right?
So they will keep on biting on it.
Okay.
Until there will be an ulcer. And once the anesthesia is gone, that will be a big swollen thing.
And it's going to freak the parents out.
Yeah, and it's going to freak the dentist too if he doesn't know.
Right. Exactly. Okay.
So usually the complication, the famous complication of local anesthesia in kids is lip biting.
That simple.
Yeah.
Wow.
Yeah, and sometimes they will give you a photo of a kid swollen lip. And sometimes they will not, and they will just explain the case, and they will say the mom came, or the mom send you a photo.
Yeah.
So, and it's very straightforward if you know the case, and it will come up a lot in your practice as well.
I see. So we heard another pearl.
Yeah.
So can you repeat that INBDE pearl?
Complication of local anesthesia in kids is lip biting.
Beautiful.
And the last question I want to share with you is about apexogenesis and apexification.
Okay.
So they usually talk about this in the exam as a case like 7-year-old patient fractured the right central incisor.
Okay.
3 hours ago. Clinical examination reveals 2 millimeter exposure of a bleeding pulp. Treatment of choice is They will give you plenty of treatment.
Okay.
And some of them actually make sense. That it's not the best, like what I said before.
That's right. The best answer.
Yeah.
Okay.
And the way I answer this kind of questions, that's like a scheme for myself. I usually, because it's like a case, so you really need to solve it in different steps.
Okay.
So the first thing I will ask myself, what is the age of this patient?
Okay.
The second thing I will ask myself is, the root is formed or not? Because if the root is formed, then there is a different treatment. If the root is not formed, that's something also different.
Okay.
The tooth is vital or not vital?
I see. Okay.
And they will not tell you the tooth is vital or not vital in the case. You have to come up with this from the explanation.
Oh, so within that explanation, will I be able to understand whether the tooth is vital or not vital?
Yeah.
Okay. Gotcha.
So
can you tell me maybe just a few things, or tell me something that would indicate that it's not vital?
Well, it's 3 hours ago. Okay. So that's like,
right. Yeah. So time.
And bleeding pulp.
Okay. Okay.
So
gotcha.
Which means like probably it is not going to be vital.
Gotcha.
And the other thing is the root. The root will know. We will know the root is formed or not because of the age. So everything they give you in the question, it has significance.
Ah.
So the age, 7 years old patient, 7 years, which means which tooth. And this usually the roots will be completed after 3 years of eruption.
I got you.
The tooth will erupt first, and then 3 years after, the root will be completed and formed.
Ah, so the pearl from here. Can you repeat that pearl?
Is you need to ask yourself, what is the age of the patient? The root is formed or not, and the tooth is vital or not vital.
Gotcha. Well, I tell you what, those are some great tips for us to know regarding pediatric dentistry. Dr. Marion, I tell you, every time you come by, you give us such good information, and we can't thank you enough. I'm sure all those who are preparing for their INBDE, they can't thank you enough. But you know what? I know one way they can thank you. They can thank you by subscribing to this podcast.
Yeah, absolutely.
All they got to do is hit that subscribe button and then hit the notification button too.
Yeah.
Because if they hit the notification button, every time that we have a podcast, it's going to let them know that we have a podcast.
Yeah, and I got to tell you that I have plenty of other podcasts coming up and things I'm preparing. So, yeah. Yes,
we got some good ones coming up. Well, thank you once again. And we hope to hear from you very soon. And for all those who are out there preparing for your INBDE exam, remember MDI Prep offers live online classes. Just go to www.mdiprep.online. And remember, no matter how tough it gets, remember, you got this.